This week's surprise announcement by a promising young NFL player that he was retiring because of concerns about brain trauma has focused even more attention on sports concussions. But as Marilyn Moritz reports, the concerns go beyond football and beyond male athletes.
One of the balls was kicked from a very far distance in the air, and I thought, like I always do, I would be able to head it. And I did.
That header at soccer practice gave 17-year-old Sophia Arce much more than a nosebleed. 3 days later, the St. Mary's Hall student athlete recalls feeling horrible.
I would sit down to do my work, and I could feel myself like thinking about what the right answer was, but not being able to communicate it in a way that was comprehensible to other people.
Sophia had suffered a concussion.
Her story is more common than you might think. When it comes to youth sports and concussions, girls soccer is second, only to football.
Female athletes are just as susceptible as male athletes.
Dr. Brad Tolan specializes in sports medicine and watches his own daughters play soccer. It's an aggressive sport, and he says concussions can happen when players collide, hit the ground, or head the ball.
Most people in the area that I grew up in, concussions were sort of a badge of courage. You get hit, you have a concussion, and you go back in the game and play. I mean, I think we've hopefully gotten smarter about how we deal with concussions.
Mostly because of football, there is more awareness about head trauma, and concussions may be better identified. The question is, are the game protocols changing the long term?
Nobody knows how many hits it takes till you have chronic or permanent damage, and that's really the issue.
As for Sophia, she's cleared to play, but chooses to no longer head the ball.
It's just something I really love doing, so I'm going to do it the safe way so I can do it for a long time.
Marilyn Moritz, KSAT 12 News.
Now, symptoms of concussions can include headaches, dizziness, or drowsiness, but kids sometimes won't speak up for fear of being out of the game. Doctors urge parents to be aware of their child's behavior.